All right, good morning. So we have a couple interesting cases to review today. It's kind of exciting. What we're going to be doing this afternoon is seating an implant hybrid bridge. And before we do that this afternoon, I'm just going to kind of review a couple cases with you and show you kind of how the history of this has changed over time. So the first case I'm showing you right here is a case where we did extractions of the upper teeth. And basically I placed bone grafts, placed implants, and then allowed that area to heal. Once everything was right where we wanted it to be, we made a porcelain fused to metal bridge that gets screwed right onto those implants. And so that was a great case, and it's been working out very nicely for the patient, but things have changed quite a bit since that time. I'm going to show you a second case, and this is where I transitioned from porcelain fused to metal bridge to a hybrid made of zirconia. And the reason why I have these two cases is actually I completed the case with porcelain fused to metal. She went home and she was happy with the prosthesis. But once she wore it for a little while, she started to feel like her bite was closed. She didn't feel like she had the proper lip support. And so when she came back, I looked at it and I said, geez, you know what? We could do things a little bit differently. And we decided to start from scratch. And I decided to try out Crown Dental that specializes in these cases. And so over here, you can see this was the final prosthesis. Came out very nice, kind of bright, no metal underneath it, so it doesn't have that grayish effect. And I'm going to show you the difference when it comes to accuracy. So this is the porcelain fused to metal bridge that I removed. And you can see that we had to pour a stone model, we had to cut the die, and you can see all the lines where we have these cuts. And so now looking back, this seems a bit archaic, where basically there's a lot of possibilities of inaccuracy. We have to take an impression, which could possibly distort. We have to pour a stone model that can have stone expansion, and we're cutting the dies, causing things that can shift a little bit. And we still have to make sure that everything here fits in the mouth accurately. Now we go to the fixed hybrid bridge. And what we do is we get to make a plastic prosthesis where the patient gets to wear as long as needed, and we can continue to make any adjustments to that plastic piece until the patient is perfectly happy with it. Once the patient is happy with it, we send this to the lab and they do a three-dimensional scan. The scan goes to a milling machine and we mill out of a zirconia puck the prosthesis that gets screwed in place. And so you can see how nicely this looks. We're going to be seating this this afternoon, and we will make a second video so you can see what that looks like.